Hey guys. So today we're going to talk about other diabetes medications. So we've talked about insulin and some other numbers and general diabetes stuff. But now let's dig into the medications because this is the part that always scares people. Like, what do I need to know about medications? And there's always a lot to know and understand, but hopefully this will help to break some stuff down. So when I'm talking about other medications, I'm usually talking about oral medications, and those are going to be for type 2 diabetes. In the insulin presentation, we talked about how for type 1 diabetes, they're always going to need insulin because they either don't make enough or they have zero insulin. So they're always going to need that replacement. But people with type 2 diabetes, they sometimes need insulin, but a lot of times they can be managed just on oral medications alone. Sometimes, like it says here, sometimes they're used alone, sometimes they're used in conjunction with insulin. And there's also other types of medications for type 2 that are subcutaneous injections. These are not insulin, but they're other medications that can help with diabetes instead of insulin or with insulin as well. So all these medications work a little differently, but some of the ways they can help is they help to make more insulin, they help to store more glucose. They can help to improve sensitivity of cells to allow more glucose to get into the cell, or they can also help to improve absorption of glucose. And this isn't an all-inclusive list. There are other things that these medications can do, but this can kind of give you an idea of how are these medications really helping the patient. So let's talk about biguanides. And when we're talking about biguanides, we're talking about metformin. And this is one that most patients and it's usually the first line drug. It's like a mainstay treatment, but it's also the one that most people are familiar with. The great thing about them is it can be used for pre-diabetes as well as diabetes, and it can really help to prevent some people from transitioning into full diabetes, and help to manage their blood glucose to prevent those complications before they start. Some considerations with these medications is that one, that it can be a little bit hard on the kidneys, and so the patient can't have IV contrast if they're taking biguanide. So let's say that I was on metformin and I needed to go have a CT scan with contrast. I would need to stop my metformin for at least 2 days before getting that scan done, unless it was emergent. And that's just because that can cause the kidneys to clog up, and it can cause the patient to go into kidney failure, the combination of the contrast and the metformin. And we definitely don't want that to happen. So we always want to get a really good history of medications before they get a scan that has contrast. The patient should take their biguanide or their metformin with food because this medication can cause a lot of GI symptoms. It can cause like nausea and stuff, and also diarrhea and stomach upset with if you don't take it with food. Keep in mind the other thing to know about this medication is one of the ways that it works is that it stops you from absorbing so many carbohydrates when you eat. So if I was on metformin and I'm eating a really carb heavy meal, like a bunch of carbs, and I take my metformin, chances are I'm probably going to poop my brains out. And that's because literally the metformin's job is to stop me from processing all those carbs. So if people, if you're taking care of a patient, they're complaining about diarrhea with their biguanide, the first thing you might want to ask them is, what's your diet look like? Because if they're eating a lot of carbs, that's going to increase the amount of diarrhea and other stuff that they're having. And it's not to say that they can't have any carbs, but it's more about like those really heavy carb meals. So if they're having a problem with that, you can always talk to them about their diet and maybe suggest trying to spread out their carbs or add in some other foods with the carbs to kind of balance it out so that they won't have that same diarrhea. We also want to watch for signs of what's called lactic acidosis. And so this is where in the muscles you convert to a different metabolism. And it can cause a lot of serious problems like acid base imbalances and stuff like that. The patient would be complaining of muscle pain, drowsiness, and they may be breathing fast because they're going into that state of acidosis. And you know what the body does when we have a state of acidosis, if you remember all your acid base stuff, it tries to breathe it off. If you don't remember your acid base stuff, don't worry, we're getting there soon. As a whole, this is a really dangerous complication. So the patient staying hydrated is key. So when they're taking their biguanide, their metformin, they need to make sure to be drinking enough water and then report any of these symptoms if they have them. So let's talk about, and I've kind of grouped these that into like problems that can happen with them, etc. So maybe that it'll be helpful, better, easier for you to remember them or put them together. So there's a class called alpha-glucosidase inhibitors, and examples of these medications are going to be acarbose or miglitazole. And so the way that they affect the GI system is the alpha-glucosidase inhibitors. These are going to cause like a profound hypoglycemia. So you always want to take it with the first bite of every meal. So if I wasn't planning on, what do you call it, eating or something like that, these medications would not be helpful to me. So I always need to make sure to take these with the first bite of each meal, because they help to stop me from processing the same amount of carbohydrates, but they also can cause hypoglycemia. So again, I'm only going to take these if I'm going to be eating. And so there's also what are called GLP-1 receptor agonists. And these are the exenatide, dulaglutide, I can't speak today. And so these are actually a sub-Q injection. And so this is one of those medications I told you about that's for type 2, but it is a sub-Q injection. And the way that they help is they actually increase your feeling of being full. So they increase what's called your satiety, or your, kind of that feeling like, oh, okay, I don't need to eat anymore. And so by doing that, that can help where you don't, ingest as many carbohydrates, which can help with that, glucose load. The thing to keep in mind with this is that also can affect your ability to absorb other medications. If it's slowing down your motility in your stomach or your processing of food in your stomach, it's also going to slow down your medications as well. So you don't want to take this injection at the same time as you're taking other important medications, because it may stop you from being able to correctly absorb those. There's also medications that can lead to infections. So there's what's called DPP4 inhibitors, and these all end in gliptins. So any medications that you see ending in gliptins, they can help to decrease the amount of glucose that you're, letting go of. They can help to regulate things in the pancreas and in the liver to help to keep that blood glucose stable. But they also do put you at risk for upper respiratory infections and pancreatitis. So if you have a patient on those medications, you'd want to watch out for those side effects. Additionally, there's what's called SGL2 inhibitors, and these all of these medications end in the word flozin. So anything cangaflozin, stuff like that. So if you see any of those, that's an SGL2 inhibitor. And the thing with these is these help by actually getting sugar out in your urine. But when it does that, it also puts you at risk for urinary tract infection. So it's great to get that sugar out. And sometimes when your body can't find any other way out, it's like, let's pee it out. But sugar attracts bacteria. So if I'm peeing out a bunch of sugar and some is kind of like getting stuck in the lining of my urinary tract, that's going to attract bacteria to my urinary tract. So I want to watch closely, for those signs and symptoms of a UTI. Teach them good hygiene and make sure that they're, aware of what the signs and symptoms of a urinary tract infection are. There's also other medications. With all of these, I would want to watch out for hypoglycemia when taking these. So there's the sulfonylureas, glipizide and glyburide. They're very helpful, but they can lower your blood glucose. And so I want to watch closely and be looking for the side effects of those medications. With the meglitinides, they all end in glenide. This is another one that I only want to take if I'm eating, because it has such a intense effect on my blood glucose. I also want to make sure that I'm not going to give it if the patient's like maybe sick and not eating, because they can have a sharp decrease in their blood glucose. And there's also a subcutaneous injection known as an amylin analog. This is something that's very similar to insulin, but it's not insulin. And a name of one of them is pramlintide. It's used with insulin. So it's kind of like it works synergistically with insulin and given as a sub-Q injection. So that's another option for something that I could give. Oh, there we go. So overall, what is my role as the nurse for these medications? I want to teach the patient about these side effects. And these are some of just the basic side effects that I kind of broke down for you about like when you want to take the medicine, when you don't want to. Like this next thing says, know when to take it. So like if you'll remember back when we were talking about the alpha-glucosidase inhibitors, we always want to take those with the first bite of the meal because the whole point of them is that when I take them, they stop me from processing so many carbs. If I'm not intaking carbs or not eating, they can't help me. It's not going to hurt me, but it can't help me. Then there's other ones like we just talked about. We call it like the meglitides. And so that can cause you, like you want to always take it with food because otherwise it can cause a really, really profound hypoglycemia. So kind of go back through this PowerPoint if you were kind of like lost or getting, I know it's a lot of medications. I really will say like, okay, well, which ones, really need to be taken with meals or need to be taken with, a certain time of the meal, et cetera, or what are my considerations? We want to monitor the blood glucose regularly. Keep in mind, that all of these, like I have down here later, all of these can cause hypoglycemia. So it's not like, oh, like I talked about these, the last three that I talked about all can cause hypoglycemia. They cause a more profound hypoglycemic effect, but keep in mind all these medications, the point is to lower your blood glucose or get that glucose into the cell where it belongs or help you to utilize insulin better. So no matter what, the whole goal is that it's going to stabilize your blood glucose. But because of that, I need to keep a regular eye on that blood glucose. Diet and exercise is key along with these medications. These pills cannot be the only fix. You have to make changes to what you're eating, and that exercise can make such a big difference. And like I mentioned, because all of these can cause hypoglycemia, you should always teach patients to keep a snack on hand, and they always should be aware of what are those signs and symptoms of hypoglycemia that they should be looking out for. So that's all I've got for this one, but hopefully it was helpful to kind of get you started to see, how to, look at these medications, how to kind of categorize them in your head, and then what are you going to do as the nurse to help the patient who's taking these. I hope this was helpful. See you next time.